This is a ton of cannabis. It's one of many grow operations throughout Utah serving thousands of patients. In fact, over 25,000 Utahns now have their medical cannabis cards, which is a huge milestone for this program that we fought for years to create. That's thousands of patients who aren't treated as criminals, who can legally use their medicine without fear of punishment. It's exciting progress. And at cannabis businesses across the state, business is booming, but there's a problem. For many patients, medical cannabis has been quite costly, especially since many of them have been unable to persuade their doctor to give them a recommendation. When this happens, they typically seek out one of a few medical providers who are openly welcoming of new medical cannabis patients. The problem? This costs a lot of money. These providers typically charge hundreds of dollars just for the visit, and insurance often does not cover it. This adds up quickly and makes it hard for patients to afford their medicine. And there are many doctors who have been willing to issue a recommendation, but unwilling to take 4 hours of a medical cannabis class and pay a fee, which are required for medical providers to recommend cannabis to their patients. This requirement created a barrier, especially for physicians who only have 1 or 2 patients wanting to use medical cannabis. It just wasn't worth these doctors' time. Now, the Utah legislature just tackled this problem head on and legalized a change that we in the Utah Patients Coalition recommended. Senate Bill 170, sponsored by Senator Escamilla, allows any doctor to recommend medical cannabis to up to 15 patients at a time without having to take this class or pay a fee. Only once they have over 15 patients will they need to step through the process to become a qualified medical provider, which lets them recommend to many more patients. Fixing this bottleneck was a major priority for us this year to help lower costs for patients. Now they're more likely to be able to stay with their doctor and get a recommendation and a visit covered by their insurance plan. This is just one of many positive tweaks made to the medical cannabis program this year to help make sure that patients can get their medicine without unreasonable or costly barriers standing in their way. Things are going pretty well, and we'll keep improving the program over time. For Libertas Institute, I'm Connor Boyack.